welcome to my podcast, Dermatologist Talks Science of Beauty. I'm Dr. Teo Wan Lin, and in this week's Dermatology Flash Briefing, we're going in depth into the interactions of our diet with the pathways involved in acne formation. For example, we often wonder if it's really true that junk food causes acne. In a previous episode, we had spoken about the influence of dairy in particular. But in this episode, we're going to delve into what we call acne metabolomics and how it affects inflammation and the process of comedogenesis. First up, 3 major food classes have been established in the scientific literature to promote acne. Firstly, the hyperglycemic carbohydrates. The second category would be the milk and dairy products. The third category are saturated fats, including trans fats, and diets that are deficient in anti-inflammatory omega-3 polyunsaturated fatty acids, which are often found in fatty fish and nuts. It is important for us to understand a little bit about the various terms, the scientific terms that we use to describe the role that diet has to play in the pathogenesis of acne here. IGF-1, for example, stands for insulin-like growth factor 1, and it is well known to be the main mediator that links dairy consumption with acne. IGF-1 is the highest at puberty, and thereafter it decreases continuously. So actually, it's not just your hormones. We know about the androgens, testosterone, which is the male hormone that is linked to acne formation. But specifically, we now know that it's actually the serum levels of IGF-1 that correlates with the manifestation of acne. And what we have found that actually supports this theory in acne pathogenesis is actually a part of a medical syndrome known as Lorentz syndrome. Lorentz syndrome is a genetic syndrome presenting with a defect in IGF-1 due to growth hormone receptor mutations. And interestingly, we find that these patients never ever develop acne, or many diseases we now consider to be related to the Western civilization and the Western diet. However, in this same group of patients, when we administer high doses of IGF-1 to these growth hormone receptor deficient patients, we find that it's then possible to induce acne and a state of hyperandrogenism. Now, what we want to focus on right now is the increasing interest in the Western diet and how it directly impacts acne metabolomics. And with regards to the high acne prevalence of over 90%, in adolescence and persistence into the second and third decades of life, we find that up to 60-70% of these individuals may actually be affected by both environmental and genetic factors which are interacting with each other to cause this predisposition to acne. And distinctively, populations that keep to Paleolithic diets, for example, those with low glycemic load without any milk or dairy consumption. For example, in the native Papua New Guinea islanders, they are literally acne-free. And we have also observed an increase in acne prevalence in the Chinese, for example, after they transitioned from traditional diets to Western nutrition. So All these accumulating evidence actually points towards the influence of nutrients and nutrition in the development of acne. Specifically, one should focus on nutrients that increase insulin, growth factor 1 signaling, what we discussed earlier, and now what we increasingly think is part of a phenomenon which is closer to an epidemic, so epidemic acne. So in a study done in a cohort of New York young adults, acne severity was associated with increased intake of sugar, high glycemic load, increase in milk consumption, and especially relevant here, saturated fat and trans fat intake. So it's actually very relevant for us to see how these nutrients interact with one's personal genetics, what we call the nutrigenomic impact, in terms of its influence on these food classes. So what we do recognize is that high intake of refined carbohydrates plays a definite role in acne formation. In a study, there was a correlation with a low glycemic load diet and a decrease in the sebaceous gland size in facial skin that was acne prone. So this was over a period of 10 weeks. This, is best described as a metabolomic reaction that's also been borne out by other studies. Milk, we have discussed in a previous episode. It's well known to increase and stimulate IGF-1. It's considered an acnegenic food. Saturated fat and trans fat is actually our focus on this podcast today. And, what we wanted to highlight is that the industrially produced trans fats, which are the permitted major components of fast food, these have been clearly demonstrated in studies to worsen acne. So hydrogenated fats, partially hydrogenated fats, these have actually replaced natural solid fats, most notably in fast food snacks and fried foods and baked goods. So all of these have been associated with diet-induced acne. So, another perspective that we are going to close with in this episode is this fundamental idea that the Western diet promotes inflammasome activation. And we know clearly that acne is related to inflammation. Well, there are clearly genetic factors, but then because of the epidemic sort of prevalence of acne, one can certainly pay more attention to the influence of environmental factors. And in this case, we're zooming in on the influence of diet on the overall evolution of acne, especially in populations that are literally acne-free, our observation of their diet. It has been said that sebum is the oil of the acne flame. So P. acnes, the bacteria that causes acne, is actually known to thrive when you have increased oil production. Additionally, the free fatty acids, actually promote the process of whitehead and blackhead formation, which we term as comedogenesis. Research has shown that the chemical mediator IL-17 contributes to keratinocyte overgrowth, and that is directly involved in the comedogenesis process that occurs in acne patients. On top of that, oleic acid, a sort of free fatty acid, when it's applied on the inner surface of the ear of rabbits in an animal study, actually induced comedone formation. In addition, there is a lot of evidence now that Western types of diet actually increases the local bioavailability of free palmitic oleic acid, which actually drives whitehead and blackhead formation as well. So, these cytokines, the interleukins, which directly play a role in inflammation, acne, and in comedone formation, are also well evidenced to be part of this entire inflammation process. With regards to dietary interventions, it's important to note that androgen abuse, the use of male hormones and steroids, for example, in bodybuilding, are also a synergistic factor to your diet in terms of the effects on acne, what we call the acnegenic effects. This, together with the Western diet driven nutrient signaling pathways with the chemical mediators we discussed earlier, overall increases the individual's chances of developing acne. Of course, that also is influenced by their personal genetic factors. So, in conclusion, I think we need to understand that there is increasing evidence of epidemic acne vulgaris, which is driven by the same processes that we observe in the systemic diseases of Western civilization, and that is in conjunction with diseases such as obesity, diabetes, and cancer. And interestingly, they all have one thing in common, which is the underlying mTORC1 drive. So, in conclusion, if you suffer from acne, I have the following advice. You should control your total caloric intake. It may be helpful to restrict your sugar and refined carbohydrate intake. The same goes for milk and protein supplements, and definitely avoid junk food, which are high in saturated fats and trans fats. And all these increase the sebum activity, which has a direct impact on acne itself. So, in closing, is there such a thing as an anti-acne diet? Well, it seems to be that a Paleolithic-like nutrition with increased intake of vegetables and fruits with low glycemic index, fish consumption that's enriched with anti-inflammatory omega-3 free fatty acids, such as in fatty salmon, for example. All these can be part of an ideal anti-acne diet that will reduce the severity of your acne and also be helpful, especially if you are undergoing treatment for your condition as well. Well, that's it for this week's Dermatology Flash Briefing. You can follow me on my Instagram at Dr. Teo Wan Lin for more podcast updates, and also refer to our podcast website, www.scienceofbeauty.net, for the latest podcast transcripts.